Telling you here at News Center 5, a CDC advisory committee will meet again tomorrow to discuss the one-dose Johnson & Johnson vaccine and the concerns that 6 women who had the shot developed rare blood clots following vaccination. To talk about COVID-19, we're joined right now by Dr. Simone Wiles, an infectious disease doctor with South Shore Health. Dr. Wiles, great to have you with us. So the use of the J&J vaccine has been paused for more than a week here in the country as experts look at those blood clot cases. Is there a chance that will change tomorrow? What are you looking at?
And I think when the advisory committee meets tomorrow, they are going to definitely give us some additional information. But I do anticipate that having weighed all the risk and benefits, they might go ahead and resume Johnson & Johnson vaccine. But they're going to be very clear about specific individuals that should be eligible for this vaccines. And also they are going to give clear guidelines for treatment options for individuals that might have developed some of these adverse complications from the J&J vaccine.
Doctor, thank you for joining us. So basically you're saying they might give age guidelines, maybe not young people. We certainly can't speak for them. And then really the critical part, and you know this as a doctor, is to give doctors this knowledge as to when these patients come in and maybe they're presenting like this, not giving them heparin and the right proper ways to treat these very rare complications. So have we learned anything more about these rare cases, and have they officially tied this to the vaccine?
Maria, you are absolutely right. They're going to be very specific with regards to the treatment options and what we're to look for as healthcare providers. Right now they are analyzing this data, poring over it, and I think they're going to tell us whether or not there is a direct link with the vaccine. So I think we'll just have to wait to see what they come up with tomorrow when they share that information.
A new report from the CDC says that Massachusetts is near the top of the list when it comes to people that are actually willing to be vaccinated against COVID-19. Yet, with it now available to the general public, is it relatively easy to get a vaccine appointment, at least if you look at the schedule? So what's your message to people who say, I'll get vaccinated, but I'm not in a rush?
I'm very happy that Massachusetts is close to the top, but of course, the big thing is, I want to make sure that people don't forget we're not done with the pandemic yet. We want to get vaccinated when it is our turn, because remember, the variants are still around, and we want to make sure that, we get ahead of the variants. And of course, the most important thing that we want to do is we want to get to herd immunity. We want to be able to get back to our new normal and try to enjoy a good summer if we can.
I would love to ask you when that will be, but we'll just wait on that because I don't think anybody really knows the answer. We can only hope. A couple of weeks ago, Massachusetts was reporting 3,000 or so new cases every day. Things were going back up. That number's back down roughly around 1,000. So is there a threshold or a number that sends the message that, okay, we have control of this and now the threat is minimal?
I am very encouraged by those numbers, but I don't like it at 1,000. I like going closer to 0. So I think once we see the trends getting closer to 0, then of course I'll feel much better. And until we get there, I'm going to say it again: wear your mask, wash your hands, practice social distancing, and of course get vaccinated as soon as you can.
Dr. Wiles, before you go, because this is very important, I want to ask you: are we learning anything new about the protection that it might give not only to pregnant women, but give to the newborns of those pregnant women? Very specific. Again, pregnancy, pregnant women, and newborns.
Yes, Ed, we do know that, the vaccine is safe and effective during pregnancy. And, right now, the preliminary data shows that, women pass the protective antibodies, which is measured in their breast milk and in the placenta. And these get passed on to the newborn. Now, we don't know how long this is going to last, these protective antibodies. So more data is to come on that, but definitely promising news.
Very interesting.
Dr. Wiles, thank you for your time.
Great to see you. Thank you, Doctor. Be well.